Hi guys, my name is Matt Jingaleski and I'm going to do my oral report on how taste aversion therapy produces a behavioural change in alcoholism. The article I'm going to be focusing on is by Matthew Owen Howard and it's titled Production and Prediction of Conditioned Alcohol Aversion. It was in the American Journal of Drug and Alcohol Abuse in 2001, issue 27, volume 3. The reason behind this experiment was that aversion experiences are well known in psychology. They're known in evolution. We know that a taste aversion can lead to, say, an animal to stop eating a certain type of food, or anything like that to avoid the same experience again. And because we've known this for so long, it was always sort of theorized that this could jump over to treat alcoholism as well. By giving the taste stimulus and then associating that with the negative effects of alcoholism, such as vomiting, nausea. But very few studies have really actually done this in practice before sort of the 1970s. And a solid link wasn't really connected due to sort of lack of data and lack of a number of people in clinical trials. Matthew Owen Howard was able to do sort of a large-scale trial, and I'll sort of tell you about that later on. So the aims of this experiment were to determine how strongly aversion therapy can cure alcoholism, and if possible to identify any specific factors of patients who are most likely to succeed in this treatment. The hypothesis is that the successful treatment of alcoholism will be obtained through aversion therapy, and previous results from experiments from the 1970s would be replicated on a larger scale of a much larger patient pool. Participants of this study were admitted to the Sheikh Shadel Hospital in Washington in the United States. This hospital is devoted to alcohol dependency, so it really treats alcoholism patients. After the initial treatments, so they get detoxified, medical exam, psychotic exam, selection was restricted to patients who had never been admitted to the hospital before. So this left 181 eligible patients, but unfortunately only 82 agreed to conduct the study. So in the method of this, to generate a nausea or vomiting reflex, patients were given a dose of etamine hydrochloride about 6 hours after fasting. The etamine drug is known to induce vomiting, and this will replicate the known factors from extreme intoxication, such as vomiting, nausea, sickness. Shortly after the expected onset of the nausea or vomiting, patients were encouraged to smell and taste their favourite alcoholic drink, but not to consume it. And after doing this for 5 or 10 minutes, patients then encouraged to drink as much alcohol as they wanted, which obviously was soon followed by the vomiting caused by the drug. This was repeated for about 20 to 30 minutes, and then patients were given their favourite alcoholic drink, spiked with etamine, to produce vomiting again at the end of the experiment. After 5 sessions of the aversion treatment, significant changes were seen in patients' behaviour. For example, patients would tend to prefer to go for a non-alcoholic drink over an alcoholic drink in a non-clinical setting, and also the experiences of alcohol-related were far less positive, and they sort of dwelled on the more vomiting, nausea, the negative experience associated with alcohol, which increased the sobriety in long term. In the conclusion of this experiment, this provided evidence that a taste and smell stimulus of alcohol generated an aversion to alcohol through the negative experiences associated with it, such as vomiting, nausea. Previous experimental data was also replicated using these new methods, compared to those of the late 70s to early 80s. And further analysis of the patient's background also showed that there were significant factors which can increase or decrease the effectiveness of the alcohol aversion therapy. I believe this article was the best of the 3 that I've analysed because there is such a large patient pool. To have 82 patients compared to the other 2 which had 25 patients and 2 patients, the clinical significance of this data is much more relevant. And also the findings seem to be a lot more in-depth. Like, this is the only article that looked at the factors associated with the alcoholism or tried to replicate other experiments instead of just initiating their own. So that, in my view, is why this article is the best article by a long way. Slight limitations are that they didn't really look in a long-term effect. For example, they didn't look over a 6-month span to see if this treatment would continue or if patients would back out of this treatment and revert back to alcoholism. That is probably the only limitation I can see of this. And that's the end of my presentation. Thanks for listening.